All right, party people, we are back at it with another one. Today, we're going to be covering leukemoid reaction as compared to leukemias. Let's get it. You see this image right here? You need to know this image because this is textbook leukemoid reaction. Maybe you haven't heard about leukemoid reaction. To explain, basically, leukemoid reaction means we have leukocytosis, usually due to infection. This is not leukemia. Now, in the case they give you a patient with fever, chills, and let's say a leukocytosis of 20,000, you have to know that the normal range for white blood cells is 4 to 11,000 per microliter. In these situations, hemoglobin and hematocrit will be normal. If you want to differentiate leukemoid reaction from leukemia, these are the key points you need to know. First and foremost, there is a test called LAP. This stands for leukocyte alkaline phosphatase. It's increased in leukemoid reaction and decreased in leukemias. So if you see a question and they mention elevated leukocyte alkaline phosphatase, in the context of infection, that means it's a leukemoid reaction. Now, if LAP is low, even before you read the rest of the question, you already should be thinking about possible leukemias. If we were to run through option choices that they could present to you on USMLE, about 80% of leukemia questions won't just give a high white blood cell count. They give you an extremely high count. So for example, for regular infections, you can have white blood cell count around 20,000. For infections or ruptured appendix, you could even get it up to 25,000. Now, one thing to know is that for pertussis, this is an exception. General infections will cause the white blood cell count to be in the teens or 20s. However, pertussis can reach up to 40,000. About 80% of leukemia questions will give you a white blood cell count of at least 50,000. ALL, acute lymphoblastic leukemia, is seen in pediatrics. The white blood cell counts are greater than 50,000 and sometimes reach up to 80,000. And of that, 90% will be lymphocytes. ALL is usually positive for CD10 and TDT marker. It's almost always a B cell lineage. In the case that's the T cell lineage, there will be clinical signs like facial flushing. Think arms above the head and you'll have the redness in the face. This is due to a thymic mass obstructing blood flow. Moving on to AML. This usually occurs in adults. You'll see blasts on the smear with Auer rod. These are needle-like inclusion composed of myeloperoxidase. This is classic AML. For CLL, it usually affects the elderly, with white blood cell counts around 80,000 composed mainly of lymphocytes. You might see smudge cells, which are just fragile, broken lymphocytes on the slide preparation. As far as hypersegmented neutrophils, B12 deficiency can cause them. Normally, neutrophils have 3 to 5 lobes. Hypersegmented neutrophils have 7 or more. If USMLE wants you thinking hypersegmented neutrophils, they'll plop one in the center of the screen, right as I'm showing you here. It'll easily have 7 or more lobes. The vignette will usually have like patient with gastric bypass or someone that's adhering to a strict vegan/vegetarian diet, everything pointing towards B12 or folate deficiency. Also, know that folate deficiency can also occur due to drugs like anti-epileptic. To summarize, leukemoid reaction is a term for leukocytosis, usually due to infection, not leukemia. Leukocyte alkaline phosphatase, LAP, is elevated in leukemoid reaction and decreased in leukemia. That's it for this one. Go crush it.